title, I am a man. Good morning, everybody. Welcome to Career Friday. My name is Shanae Fan. I work in the Office of College and Career Readiness. Specifically, I work on the career readiness side, and I love being a CTE manager. I've been with City Schools for 6 years, and one of the things that I enjoy most is getting out into schools and working with and supporting our CTE pathways. I do manage our Academy of Health Professions pathways, and I'm going to tell you just a little bit about the different offerings that we have. We have many pathways that come underneath the umbrella of Academy of Health Professions, including nursing assistant, dental assistant, pharmacy technician, surgical technician. We also have our sports medicine program. These programs are in many high schools throughout Baltimore City. We have programs at Edmondson Westside High School, where I am today. We have programs at Reach Partnership. We have programs at Mervo. We have programs at Vivian T. Thomas. We also have programs at Patterson High School. I think I caught all of them. If I missed any, can somebody let me know? But one of the things I want you to know is that we also have up and coming program at Dunbar, and you may hear a little bit about Green Street Academy. But if in fact you even have just a small interest in of these industries, you certainly want to take a look. Right now, I am at Edmondson Westside High School. We're going to be in the nursing assistant pathway. And what I love is that not only do our students have the ability to earn their CNA, they also have an ability to earn their GNA. Greg, do you want to talk a little bit about some of the post-secondary opportunities in Academy of Health Professions before we jump right in and speak to our students?
Absolutely, I would love to. So as I mentioned earlier, and thank you so much, Shanae. As I mentioned earlier, my name is Greg, and I work for the Grads to Careers program. And what our program is all about is essentially lining up any student with a post-secondary option that wants to go into career training. And we are very excited to work with the Academy of Health Professions. This year is our first year working with them for the Certified Medical Assistant Training Program. So that is a really cool, exciting new option. It's about 8 to 10 months long, and you can get yourself a job in a hospital working as a certified medical assistant. So there's some of the eligibility requirements for Grads to Careers right there on the screen. But the main thing we want you to know is that it is a free career training opportunity for you once you graduate from high school. So for anybody thinking about the horizon and thinking about careers in healthcare, please keep Grads to Careers in mind. And if you're interested, there's a link at the bottom for our interest form right there. It's a bit.ly link that you can just type that into your browser, that bit.ly/G2C now. And we would love to hear from you, and we'd love to talk more with you about this opportunity. We love our partners, and we're really excited to be partnering with the Academy of Health Professions. So I'm going to kick it back to you, Shanae.
Thank you so much, Greg. So I want you to know that I am at the Edmondson Westside High School, go Red Storm. And I'm going to tell you that one of the things that I love is that our students get to learn excuse me, in a state-of-the-art lab. And so we have so many seniors here, and the multitask is real. They're in this class. They're also working on their financial aid, which is very important because our students have options. Our CTE pathways lead to industry credentials, but excuse me, they also lead to paths, whether it's straight into the world of work or into college. So our students are learning about financial aid, but they're also going to take a little bit of time to talk to us a little bit about their CTE pathway. So I'm going to pan the room really quickly just so that you can see our scholars who are avidly working. And so who's going to be up first to tell me a little bit about their pathway? Here we go. Give me a name. So this is Ashley. Ashley is one of our eager, enthusiastic seniors who's going to tell us a little bit about herself, and she's going to tell me what made her choose the nursing assistant pathway.
Made me choose the nursing assistant.
Well, tell us a little bit about yourself first.
I'm 17. I'm 17. But what made me choose this is because I had a sick cousin that had normal seizures back to back, and she almost died when I was younger. Mm-hmm. So I just want to make sure that don't ever happen again. So that's why I wanted to become a nurse or a CNA GNA.
Okay, excellent, Ashley. So can you tell me, give me your name? Zanaya. So this is Zanaya, and Zanaya, actually, last time I was here, she showed me how to use the scale. Can you tell us a little bit about yourself and why you chose the nursing assistant pathway?
I'm a senior at Emerson Westside High School. I chose the nursing pathway because I have elders that are sick and I want to help them to be better.
Okay, excellent. So we see here that a lot of our students chose to go into patient care because they wanted to help others. Anybody else? Let's see right here. So tell us a little bit about yourself and why you chose the nursing assistant pathway.
My name is Shadi. I'm 17. I chose the nursing assistant pathway because I grew up around people in the nursing field, such as my grandmother, my family, like family friends. So me growing up seeing them help others make me want to help others.
Excellent. So let's talk about a demonstration. We have a nice patient right here. What's our patient's name? Can somebody tell us what our patient's name is? This is Brandon. So who's going to show me a skill with Brandon? Ash, are you going to show me?
Hey, Shanae.
Yes, sir.
Someone put in the chat that it's a little bit difficult to hear the students, so they can just speak up a little bit.
Okay, we're going to do the very best we can.
Thank you so
Okay.
much.
So this is Ashley and this is Brandon.
This is a patient that we have in Emerson. Basically, some of the skills that we learn is called more like vital signs, like pulse, respiration, blood pressure. And basically how you take a pulse is you go to the left side where it's your thumb, and you feel for a pulse or whatever. And if it's faint or if it's real like heavy, this is the right arm. If it's faint, you will try the next arm to see if it's just like this one. But you put your 2 fingers like at least 2 inches down from your thumb and keep feeling till you feel it, or whatever the case may be. And you basically just count what you hear. And it has to be really quiet or whatever so you can hear it. And you just keep counting and you use it for 1 minute.
Okay.
And just keep counting. And that's how you take a pulse.
That's how you take a pulse. Excellent. So one of the things that you guys showed me last time I was here is how to care for a patient if a patient needs to be bathed. Can somebody else show me another skill on Brandon? And here we go. We have 2 students who are coming. So as they're coming, guys, if you have any particular questions for our students at Emerson Westside, please feel free to ask in the chat. We'll be able to check the chat. Give me your name, baby girl.
Autumn.
This is Autumn. And one of the things that I love is that Autumn is actually washing her hands first, which is an amazing best practice, even when we're using our simulator mannequin. And so she's washing her hands and she's going to come and show us how do we actually care for our patient. And so one of the things that they told me first is that they always speak to the patient. They ask the patient how the patient is doing. And then they always make sure they let the patient know what they're going to do before they do it. Correct?
Yeah.
Okay.
So today I'll be showing you how to do primary care, which is washing your patient, female or male, genital area.
Okay. And
So
so
this is the female, and this is the last thing you do when caring for a patient. Always make sure you take your rag and you put it in full. You put soap on each end of your rag and you wash each side with the sides that you fold and put soap on.
And notice how she's folding.
And when finished, you make sure that you dry your patient so that it won't be wet. Because if you keep a patient wet, they can get infections or bacteria and stuff like that. You don't want that happen to your patient. And you don't make sure you cover your patient at front and give them their privacy.
Excellent. And so one of the things they also mentioned is that you always draw the curtain to make sure that you give patients the appropriate privacy that they need. Excellent. So now we're going to talk about what are some of the next steps after high school. Okay. So You want to talk about, so Ashley is going to tell us what she plans to do at the high school.
I plan on working at University of Maryland part-time and going to Morgan State University to get my RNA. And after I get out of university, I'll be going to Mercy full-time to be an RNA.
Excellent. Thank you. So let's talk about some other opportunities after high school. Here we go. Give me your name first.
Shauna.
So this is Tyshana, who's also a senior. What are some of your plans at the high school?
At the high school, I plan on going to college, and then I'll be doing part-time stuff like around, and then I plan on moving to Texas, and then I want to work in a women's hospital, be a pediatric nurse.
Excellent. So we have a pediatric nurse on the horizon. Anybody else want to share some of their goals and aspirations?
Sure.
Give me your name.
My name is Michaela.
Mhm.
I'm a senior here. Right after high school, I plan on going to college to Coppin State University, and I plan on getting a degree in biology in medical school to become an obstetrician.
Excellent. So how has Edmondson and being in this nursing assistant pathway prepared you for your post-secondary options and opportunities?
It just has given me a lot of experience, especially being, doing clinicals at the University of Maryland Medical Center, dealing with actual patients, doing ADLs or activities of daily living, just caring for them, whether it's bathing them or doing vital signs every 4 hours. It's just, having compassion for people, in real life that need our help. So it's just, prepared me by giving me experience.
Excellent. And what advice would you give to a middle school student who is thinking about going to a CTE center and trying to select or pick what CTE pathway to pick?
Just, take all the opportunities that come to you, and just follow your heart, or whatever you're passionate about, whatever you want to do, just do it.
Okay, excellent. So that was Michaela. Do we have one more student who wants to round this off with their post-secondary opportunities, what they plan to do at the high school? Thank you.
After high school, I plan on working in a nursing home,
Okay.
and I actually want to be a pediatrician. So first I'm gonna do nursing home part-time, and then work my way in college to become that.
Excellent. And so one of the things that I'm super excited about, guys, is that I will be coming back to talk to our Academy of Health Profession students, definitely at Edmondson and throughout the city, about some of the options and opportunities for the summer, whether they want to work in a hospital or just get some experience. They'll be able to do that with many of our programs. So do we have any questions for our students?
We got a lot of shout outs in the chat, and just a lot of thank yous. Going through here, just lots and lots of shout outs of people liking what they heard. We got some love from Morgan State. Go Bears. If anybody has any last questions in the chat, please feel free to put them in now. And Shanae, I'd just love to say that what Michaela just said really spoke to me. One of the best parts of my job is getting to hear graduates talk about what they want to do with their lives and talk about their passions. And just Michaela saying, follow your heart and your passions definitely really moved me. So I want to just thank you, Michaela, for that, those words of wisdom, and just wish you the best.
Greg, we actually got a couple of questions in the chat now.
Oh, here we go. Okay.
Yeah.
So we have one question that says, what if a person doesn't pass high school? That's an excellent question. We are in the Office of College and Career Readiness. We make sure that we are working to support the whole student. So inside the school, there are many supports, whether it's through school counseling or guidance, to make sure our students have all of the academic supports that they need. But you do need to have a high school diploma in order to pursue careers after high school. Okay, and so we're going to make sure that our students not only graduate with the high school diploma, but also graduate with the industry credential as well.
Then we have another question of, do you work with other programs in the city?
So is that a question for me specifically? So yes, I do support our Academy of Health Professions pathways, but I also work with our culinary arts and commercial baking. I also support our cosmetology and cosmetic services programs, and then a host of other duties as assigned. If in fact you're talking about our students do work with university, they have a partnership with University of Maryland, and I believe some other opportunities as well.
Okay, I think there was a follow-up to that too, that was, for instance, with Vivian T. Thomas students.
So yes, there is a CTE pathway at Vivian T. Thomas. They have all of our medical programs. They have nursing assistant, dental assistant, pharmacy technician. They also have PLCW biomedical. They do not have surgical technician, but that's why we are here at the Emerson Westside High School, which has the only current surgical technician program.
Awesome. We do
What
have
is it like to be a nurse? It was one of the questions that someone put in there in the chat.
So that's an excellent question. Does anybody they may not be able to tell you what it's like to be a nurse, but they may be able to tell you what it's like to be a CNA student, the day in the life of a CNA student. Does anybody want to share? Someone said it's hard. Tell me what's hard and what makes it hard.
What makes it hard is when you have a lot of classes at once and you got like different things. You gotta wake up early in the morning. You gotta get here on time. You gotta think about the other classes. You gotta think about stuff that you gotta get done here. It's hard.
It's hard, but guess what? The balance is what gives us the fortitude to move on. You do have to be here on time. We probably have time for one more question in chat. Greg or Adenike, somebody who's moderating, can you just give me the last question before we move on?
Can nurses help end COVID?
It's possible.
Anything is possible, but we can help prevent the spread of COVID by, exemplifying best practices. We make sure that we are socially distancing still. We're wearing masks correctly above the nose, over the mouth, down the chin, washing our hands, using hand sanitizer, and just making sure that any event that we feel sick, we stay home. And that's a best practice. You don't even have to be a nurse to exemplify those best practices. But I would like to corporately thank Emerson Westside High School nursing assistant. I would like to thank our nursing assistant instructor, Nurse Tara Williams, for all of the amazing work that you're doing. And I'm going to throw it back to you, Greg.
Thank you so much. That was awesome. I really, really want to thank Evanston Westside as well, and just thank all the students and teachers that made that possible. I'm definitely inspired, and it's really just awesome to get a glimpse inside the classroom and just see what y'all are learning over there. So we, without further ado, are going to swing over to our next stop on the tour, which is the Maryland Radiological Society. And we're going to be having a question and answer session with Dr. Cynthia. So just give us 1 second while we get that queued up here, okay? And we thank everybody for all their wonderful questions and their feedback in the chat. It's just really great to see everyone interacting, and we hope that, again, that you stay curious and that we're spurring some questions in your minds as you're seeing these different hubs of the tour.
All right.
Hi, everyone.
Okay, there we go. We've got Dr. Cynthia on the line. Welcome, and thanks for joining us today.
Thank you. Thank you. Thank you for having me. The classroom at Edmondson High looks awesome. Super happy for you guys. You guys have a really nice facility out there.
Yeah, absolutely. Absolutely. So do you think, so my name is Greg with the Grads to Careers program I'm hosting today. Do you think you just introduce yourself really briefly?
Sure. My name is Cynthia Chalitko, and I am a radiology resident at the University of Maryland. So that means I'm a medical doctor currently in further training to become a radiologist.
Okay.
And I'm going to show you all will see this video that I put together for you, kind of telling you what a radiologist does. And there's multiple jobs that are kind of involved in the radiology field itself. Some are allied health. Obviously, to be a radiologist, you have to become a medical doctor. Like Michaela was saying, she's going to become a medical doctor. But there's other little avenues that you can go into to get into the field of radiology that I touch on briefly in the video.
Okay, wonderful, wonderful. Are we going to go ahead with the video now, or are we going to do it after the the Q&A?
We're gonna do the video first.
Okay, thank you. Please excuse me, everybody, for the questions here. Hang on tight, and we're going to queue up the video right now.
You're doing amazing, Greg. Thank you.
All right, just 1 second, give me one moment. Greg, while I'm pulling this up, maybe you can jump into just one question real quick, and then I'll pull it up.
Yeah, absolutely. Great idea. Great idea. So could we just ask you real quick, do you mind if we call you Dr. Cynthia? Does that work? Or
Yeah, you can call me Cynthia.
What do you prefer? Okay, great. Would you be able to describe your career and educational journey, and then how it helped you get your current job? It's a bit of a big question, but
Yeah, so it's quite a long journey, but I don't think of it as school. I just think of it as, going through life, getting to where I want to be. So I obviously went through elementary school, middle school, high school, and then I went to college at the University of Maryland, Baltimore County. After that, I went to medical school. And then after medical school, the way medical school works usually is 2 years in the classroom, 2 years in a hospital. And then after that, you apply for a residency. And you go through this big application process, and then you get placed at a hospital somewhere in the country, and you go under training for whether it's radiology, internal medicine, OB/GYN, pediatrics. That's when you pick a field to go into, and then you undergo your residency training there, and then after that you can go into fellowship. So after high school, it's about 13 years to become a radiologist. So it's quite some time, but if you enjoy what you're doing, I think it's totally worth it. You are learning constantly, you're meeting new people constantly. The field is very rewarding. And it looks like they have a video ready. So I'll let you guys get a better idea from this video put together.
yeah, absolutely. And thank you. And we'll delve back in more after the video.
Okay.
Hi everyone, my name is Dr. Cynthia Chlitko, and I'm a diagnostic radiology resident at the University of Maryland Medical Center and the current president of the Maryland Radiological Society Resident and Fellow Section. It's my privilege to represent both the diagnostic program at Maryland and the MRS as I introduce you all to the exciting field of radiology. I'm happy to be here with you all today. I'm hoping that I can answer any questions that you may have, and I'm really hoping that I can recruit some future radiologists. So with that, let's go ahead and get started with our video. Radiologists are similar to other doctors in that we all attend college and then medical school. But afterwards, we receive specialized training so that we can diagnose or figure out what's wrong with a patient by looking inside of them. Kind of like this. Just kidding. Not like this. We use specialized equipment and machines that use magnets, ultrasound, or ionizing radiation to produce anatomical images of patients. Like the CT scanner, or this ultrasound probe, or this MRI scanner, or this fluoroscopy machine, or this X-ray equipment. Radiologists can work in a variety of settings. Some work in academic or community hospitals. Some work in doctor's offices or private practices. Some even work from home, reading imaging studies for patients around the world. To understand a radiologist's role a bit more thoroughly, let's take a look at the following scenario. When a patient goes to see their doctor with a symptom, the doctor will assess the patient and determine if the patient needs an imaging study. This patient has a headache, and the doctor thinks that an MRI would be helpful in determining the cause of her headache. The doctor then places an order for the imaging study. The patient will then head to the radiology suite, and with the help of the radiologic technician, they will be set up appropriately for their imaging study. A radiologic technician is not a radiologist. They are allied health professionals that play a vital role in patient care. The job requires fewer years in school relative to a medical degree, though the schooling is certainly still rigorous. The radiologic technologist is responsible for making sure the images obtained from the equipment will be optimal for the radiologist. The images are then sent over to the radiologist's workstation for imaging review. Here's that MRI on our patient that had a headache. After carefully reviewing the images for any abnormalities, the radiologist will construct a report. The patient's doctor will then receive the results, and in turn, she can relay them to the patient. In this case, everything was normal. But oftentimes, scans and imaging studies aren't normal. We see significant findings, like this brain tumor. Radiologists often know about the decisions, habits, and lifestyle of patients without ever even meeting them. Like this radiologist knew that her patient was a smoker, based on the imaging findings on this CT, which are characteristic of smoking-related lung disease. In order to recognize abnormal, radiologists must be really good at knowing what is actually normal, like this CT scan of the chest. We can even use our software to make 3D reconstructions of anatomical structures. So far, you've seen examples of CT and MRI, but don't forget, radiologists look at plenty of radiographs. Radiologists also perform dynamic studies that allow us to learn more about a patient's anatomy, physiology, and pathology. Radiologists also use imaging as a screening tool in order to detect cancer early so that patients can receive treatment and have better outcomes. Here's an example of a breast cancer detected on screening mammography and a lung cancer detected on screening CT and a polyp detected on screening colonography. Some radiologists are interventionalists, meaning they use imaging studies to perform procedures on patients. These procedures are often life-saving. Well, that's all I have for you today. I hope you guys are all having an awesome career fair. I hope some of you out there are interested in radiology, and feel free to reach out and contact me if you have any questions.
All right, thank you everyone for your attention. I'm happy to take some questions now. I know I didn't get to all of them in the chat.
We actually have a lot of questions coming in the chat. I don't know if you can see that, but they're actually related to, so one of the questions we had queued up was, how did your high school experience, classes or clubs impact your career choices? And we've had a couple people in the chat asking just if you'd recommend a school you went to become who you are now. So kind of related to schooling suggestions.
So I actually didn't decide to go to medical school until after college. So when I was in high school, my experience there really didn't affect my decision much, but I did have a science teacher who really inspired me to go and major in biology when I went into college. So it was really his impression on my life was just, he was just kind of like, you're good at this. Having someone behind you to tell you that you're good at this makes you want to work harder and be even better at it. So I think that was something that really helped guide my career. It didn't exactly push me into medicine at that point, but it pushed me to get a degree in biology, which got me the prerequisites to then apply for medical school. I think that you guys, what you're looking at right now, you guys have an idea of what you want to do in your future. And so you have every avenue and every resource to get to where you want to be. So I think that's really awesome. Everything is in your control right now. So if you wanted to go to medical school, you could start working towards that right now. You can start thinking about what field you want to go into. You can kind of get connections, start talking to people, maybe shadow someone to see if it's what you really want to do. And getting that experience early is really awesome, but it's also important to kind of, you know, be a kid and relax and enjoy high school with your friends, while at the same time getting good grades so that you can get into college.
No, that's awesome and wonderful advice. So we're gonna have just a little bit of fun. We've got a couple questions about kind of the work that you do, anything like some of the stuff you see on shows like Grey's Anatomy, and the thing, a lot of the kind of, you know, popular depictions of, you know, working in medicine that are on TV.
Yeah, so admittedly, I haven't watched Grey's Anatomy. I don't know how I got by never watching that, but I do love House. I don't know if anybody else here watches House. So the diagnoses in House, they're actually really good. The way they go about diagnosing the patient isn't accurate. You don't have one team that's, you know, evaluating the patient, then performing the surgery, and then looking at the MRI. It's all different teams working to diagnose the patient and to get them better. But I've seen other shows like Chicago Med. There's aspects of it that are accurate, but a lot of it is just, you know, about the drama, which I guess we have real drama in the hospital too, you know?
Yeah, absolutely. Absolutely. We do have one question from Jada Simone about referring back to the video. How do you know which little blob is which when you look at some of those images?
I saw that question. That's funny, Jada. I'm not sure what you mean, which little blob is which, but it takes a long time. So in medical school, and I'm sure you guys are learning now, I saw some little models back there, but you learn the anatomy of the human body. And then after that, you kind of learn how the anatomy looks on imaging studies. And then when we go into radiology training, you learn that really in depth. So we learn what normal anatomy looks like on imaging, and then we figure out, you know, what the abnormal looks like. So which little blob is which it can be actually tough if you're looking at, especially like an ultrasound study and nothing is labeled, you know, there's like a cyst and an ovary. Some things can look very similar, but it takes a lot of experience in looking at these things to know what you're looking at.
Okay, thanks so much. We do have another really awesome question here. What struggles did you overcome to be successful? That's coming from Ashton.
That's a really good question. So, in college, I didn't have the goal of going to medical school, so I wasn't pre-med. I didn't have the pre-med advisors. I didn't study really hard. I was happy with just being average. And I actually had my own tragic medical event in my 4th year of college that kind of got me to wake up. I had a stroke, and luckily I'm completely fine. They found that I had a heart defect, and I got the heart defect repaired. But after that, I was kind of just like, wow, what have I been doing? I've just been like, you know, taking advantage of everything that's put in front of me. I want to kind of apply myself more. But I couldn't go back and change my B's to A's or my C's to A's. I passed everything, but I didn't look like the pre-med students who had all A's. So that was pretty tough, kind of going back and, you know, working to get into medical school. But I was able to do it. And I think anyone that really wants to go to medical school will be able to do it. Like I was saying before, how you guys have control right now, you know what you want to do, so you have full control over your grades. If you're struggling, talk to someone so that you can get your grades up, so that when you put your applications in, you have nothing to worry about.
Absolutely. I think we have time for just one more question, and I'm sorry we're not going to get to all the questions here, but I really appreciate everyone's feedback. We have just one more question here. That is, what subjects do you have to be strong in to get into medical school, from Natasha?
Biology. So biology, chemistry, you have to get good grades in those. Also, extracurricular activities, they really love if you're participating in other things outside of the sciences, because we want a more diverse population in medicine because it's really helpful. You can actually get a college degree in something like history as long as on the side you're completing the prerequisites to get into medical school. And medical school admission boards actually really like that. So if anyone is interested in something else like psychology or history or any kind of liberal arts degree, that looks really good in an application. But alongside of that, you'll have to be getting the prerequisites.
Okay, well, thank you so much. We have so many more questions, and so students, we're going to try our best to try to see if we can get Dr. Cynthia to send around some answers to these questions maybe after the fact. And it looks like you've spurred just a huge outpouring of interest in radiology, and we just want to thank you so much for being here with us, and for giving us such a wonderful overview of your journey to your career, and just spurring everybody's interest today.
Oh, well, thank you guys. I wish I could be there in person to meet all of you, but it was really nice that we could do this over Zoom and have multiple schools here. Really nice to be here. Thank you guys.
Absolutely. Thanks so much for being with us. And we hope you have a good rest of the day.
Thank you.
Okay, so we are going to go to our third leg on our journey today. Thank you everybody for your wonderful questions. And like I said, we're going to try to get some feedback and get your questions answered after this. But we're going to pass it to my colleague, Ms. Shamara, for the third leg on our tour, which is going over to the Maryland Radiological Society. Oh, no, I'm sorry. I'm getting confused here. To the occupational and physical therapy demo at Future Care. Sorry, Shamara.
Good morning. Thank you, Greg. Happy Friday, everybody. Thanks for joining us for Career Ready Fridays as we are exploring careers in healthcare. I hope you all are having a wonderful time. I have a treat for you all for our last stop. If you can, put in the chat, give me some high fives and let me know how you're enjoying today's Career Ready Friday. Today, we're at the Future Care healthcare facility where we will view a occupational therapy rehabilitation demo. I'm going to share my screen and kind of pan around the room here. We have Lauren Osby. Please introduce yourself to our students here in Baltimore City and tell us what you do.
Hi there, I'm Lauren. I am a rehab director, but also an occupational therapist here at Future Care Homewood. This is a skilled nursing facility, so we have patients from 18 up to 100 that we see every day to try to get them stronger. I have some friends here doing some exercise, trying to get their legs stronger. Hello, this is Daniela and Cordrell.
Cordrell, please introduce yourself, and then we're going to see a demo of the equipment and see what some people do here at Future Care.
Okay, my name is Cordrell. I'm a DNA Splash, a rehab tech. I got into this career because I love to help people. Helping people is my passion. It makes me proud to do what I can do for people, and I love to see the smiles on their face.
Thank you. So Lauren, where do you want us to start here
All right.
today?
So for physical therapy and occupational therapy, you need muscles in order to walk, in order to dress yourself, in order to do everything. So Daniela here is on our bike. She's another occupational therapist. She's going to get off the bike and we're going to go practice getting in and out of the car. Before patients go home, she's going to use a walker too. If she needs a hand, she'll tell me.
And these are all skills that we use every day, but sometimes things happen and we need a little bit of help.
Get sick, you might have some illness, something happens. I know the previous people were talking about cancer. We see all types of patients here. Open the car door, so we have a practice car. We have patients get in and out before they can go home so they can practice for when they have to go home. Very important. Look at that. She's in her fancy taxi cab.
Woo, it's yellow. Very good, Daniela. You want to introduce yourself and tell everybody how you got into this field?
Hello, everyone. My name is Daniela. I'm a certified occupational therapy assistant. I also got into this field like Cordrell did because I love helping people. This job gives you a nice sense of fulfillment from seeing the smiles on everyone's faces and watching them walk out of here when they weren't able to do so when they first came in. So it's very rewarding.
Yeah.
Thank you.
We've got all different types of equipment. We've got some strengthening equipment over there, make arms strong, your trunk strong. People work out here, do pull-ups, you name it. We got lots and lots of bikes, which is awesome. Patients love the bikes. We jam out to some music, which is very important. And then another part of occupational therapy is working on cooking and doing household tasks, working on getting dressed again. So we have lots of different, we have a whole kitchen set up. We can go back there.
Wonderful. While we go to the kitchen, Lauren, can you tell me, how did your high school experiences shape your career choices or your decisions?
So I was in a like medical interest class in my high school. So I was kind of exposed to multiple different, like you guys were today, multiple different realms. I knew my grandfather had a stroke and I knew I was interested in therapy because he had gotten occupational therapy. He couldn't feed himself. And then all of a sudden he was feeding himself. I was amazed. So I knew at that age, when I was in 10th grade, that I wanted to do that. So I went and kind of like here, I came here and I watched how the therapist helped people. I got some hours, some shadowing, and that's how I kind of decided that's what I wanted to do.
Someone wants to know, is your grandfather okay now?
He is okay now. Thank you for asking. I appreciate that.
All
So
right.
this is our kitchen setup. We have patients cook. We have patients look in the cabinets for food. We got all different types of food. Sometimes we go on a shopping spree and we'll have them get stuff and carry grocery bags because you got to do that when you go home. We also have a washer dryer, parallel bars. You guys have probably seen maybe before if you ever go to PT outpatient or if your mom or dad got PT. It works when you can't stand so well. You hold on to the bars and you work on walking. Got some steps, all different types of stuff. Similar to you guys, we have an Xbox and a PlayStation. We have a lot of games on these type of devices. It's really fun. Patients love it. They can look at the TV and they can practice. And then we got all types of balls and everything.
So what were your biggest wins as you worked to get here or where you are now?
Biggest wins. I would say going to school was really important and that was a win. I graduated. Another win, I essentially knew what I wanted to do and I was really interested and I got to excel in that.
All right. So are there any programs, books, podcasts, videos, or other resources students should be looking into if they're interested in becoming an occupational therapist?
So like I know the lady had said before me, any interest in bio, if you have interest in muscles, stuff like that, you could look into, different books on the muscles, bones. It's really important to know all of that so you know what you need to work on. You see people with all different types of injuries, hips, knees, shoulders, it all. So you want to look and research and just, if you're interested, you could watch some YouTube channels. You could Google occupational therapy, physical therapy. There's some really good information out there.
Someone wanted to know what kind of education did you need to become an occupational therapist?
That's a good question. So as an OT, I went to 5-year schooling and I got my master's degree. But the assistant occupational therapist, Daniela, she went to CCBC and she has her associates in occupational therapy.
Wow.
So there's 2 different types.
All right. Do we have some other questions, Greg? I can't see as we walk over to check out the other machine. It's a gravity-defying treadmill that we're going to watch.
We've got a lot of commentary on people liking the lounge, and you got to the question about what type of schooling. And there is a question from Dakota about, is there a way to tell if a person has cancer or to tell cancer apart from other illnesses?
Oh, I think that was for Dr. Cynthia, right?
It just came in, so I think she.
Oh, wow. Okay, sorry.
So patients that come here, a lot of the times they would, if they have other things going on, they go to the hospital, to the radiologists, many different people to get those answers. What they come here with is a diagnosis usually, and then we kind of treat what we see or what it says.
All right. I just want you to know that everybody is ranting and raving about your car. They love it. They love it.
Cool.
Greg, can you field some more questions as we make our way over?
Absolutely. Okay, so we've got one question here from Olive. Is what type of things do you see when you take care of people?
What type of things do I see? Well, what I like to see is family members come in and help motivate patients. Patients want to go home. They don't want to stay here, and they do go home. But sometimes if you're really sick, you got to stay here a little longer. So we We see a lot of family support. We see a lot of grandkids, all different types of people. And what else do we see? We see some things, you know, some injuries that we're not used to, so we get to learn different things.
Someone said, is occupational therapy only in hospitals or other places like
No.
schools?
Yes, it is in schools. So OT and PT is everywhere. OTs in schools work on things like balance, handwriting, different things in a place like this. There's OT everywhere. Hospitals, home, you get it everywhere.
So someone wanted to know, what does your job consist of daily?
So my job daily, I get to work and I help people to get dressed in the morning. I help them to walk. I help them come down here and get their arms strong. All different things, work on balance. So we bring them down in different types. We normally have this gym filled and it's like 10 people. We might play ball tosses to work on balance.
Wonderful. So can you tell us about the next machine?
Yeah, so Cordell here is on an anti-gravity treadmill. So what she can do is she can see her feet up at the top. So she can look at and analyze how she's stepping. Right now, she only feels 50% of her weight. It's almost like being in space. We could get her to run if we wanted to be mean.
Do y'all want to see her run on the anti-gravity machine?
Yeah. We just got a really great question of how is OT different from sports medicine?
So there's a good question, Lauren. How is occupational therapy different than sports medicine?
So there's a lot of overlap in both of them, but sports medicine is really related to the sport. So injury in football and so on. Whereas occupational therapists might see patients that had a sport injury, but it's different. They're very similar, but different in the same respect.
Okay. Someone wants to know, how can she only feel 50% of her body weight in this machine?
So she is zipped in tight in this machine. So I can't get her out if I wanted to. It's blocking off all the air. So that's why it's blown up really big. So right now I'm going to take her all the way down to 25%. So she weighed 100 pounds. She would only feel 25 of those pounds. Pretty cool. It's a lot of math too, right? OT and PT, we're doing math.
So this is future healthcare. So someone wants to know, have you ever done therapy on someone with scoliosis?
Yes, a lot of people have scoliosis. Yep, we've done that before. Sometimes it's with other things, but yes, yep, you strengthen the back, you stretch it.
All right. And I think my last question is, were there any challenges that you faced and you had to overcome them to become an occupational therapist?
Challenges. School is hard, but as long as you try hard, you study, I'd say that was really the only challenge. A lot of people need help, so OT and PT is really important, and school is what'll get you there. So there's definitely a job.
All right. Do you, Cordella or Daniela, have any final words for our city school students?
You know, this career is very fulfilling. That's what I can say. You go home every day just with a sense of care in your heart. So it's very fulfilling for me.
Thank you. Daniela is chilling in the car. Did you have any parting words for our students here?
When I was in school, I would access YouTube to answer some more questions or to become more knowledgeable. So if you are still interested after this, I would encourage going on YouTube or different forms of social media to see what else is out there. Like sports medicine, there's different types where overlapping occurs. So this might not be the specific field for you, but it doesn't mean that you can't find something similar to this if you are enjoying this.
So Daniela, I have a specific question for you. Can you tell us about your qualifications to be an occupational therapist assistant?
So I went to CCBC, as Lauren said earlier. It is about 2 years of prerequisites where you do your biology, math, your basics, and then it's 2 years in the actual program. 1.5 years is in school, and then the other half is in a setting like this where you work one-on-one with the patients in either a psych setting or, like I said, in a setting like this. So overall, it was about 4 years. It wasn't too bad.
All right. So you said about 4 years total?
So 4
Okay.
years total.
Okay. Do you,
CCBC has a great program. A lot of their students come here to shadow and to work hands-on.
so you hear that? CCBC has a great program. Greg, does Grads to Careers have any partnerships for occupational therapy? with
We do not.
CCBC?
We do not currently. We do work with CCBC for a few other healthcare professions, but not occupational
Oh,
therapy.
okay. Do we have any other questions before I pass it back to you all?
We had one question about what the pay is like. A lot of people asking what the pay is like.
Yes, the pay is good. I agree. Yes.
You know, people want to know.
But what's most important is helping other people, right? But the pay is good. It is a good paying job. You work 40 hours like most people, right? It's good pay.
All right. Well,
Well, thank you so much.
thank you
Shamara.
so much, Greg.
We appreciate you and
hosting. I'm gonna pass it back to you all.
absolutely. Just real quick, Albert, I just want to remind all the students that Dr. Cynthia just dropped some really great answers to all your questions in the chat. So if you want to scroll up, I know there are a lot of questions unanswered, but she went ahead and answered, looks like all of them. So thank you so much for those responses.
Yes, thank you so much. This is a wonderful tour. Every time we do another one of these, I'm always learning alongside our students and others who participate. So thank you so much for all of our presenters, our panelists, tour guides, everyone who was involved in this event. It was truly remarkable. I do want to remind everyone that there are so many ways that you can continue to stay involved with the different programming that we're putting on in the Office of College and Career Readiness. We're always having new events and new activities going on. So I just put some links in the chat to some things that we would love for you all to be involved with. One of them really quickly, I want to remind you all to make sure that if you are between the ages of 14 or probably 18 or maybe even 19 in our high schools, then you can apply for YouthWorks. We encourage you, if you are at least 14 years of age, to apply for YouthWorks by April 1st, which is the deadline. Our next Career Ready Friday is next month. As you all know, we have one each and every month of the school year. We're going to be focusing on business, careers in business and finance. We have a great list of guests who are going to be joining us on April the 8th from 9 to 10 a.m. So I'll put a link in the chat. Please make sure that you sign up your classes, teachers and counselors and other adults who are joining us. We'd love to have all of these wonderful students come back. On April the 28th, we have a M&T Bank Teach Children to Save Financial Literacy Workshop. And again, I put the link in the chat for that as well, and I'm gonna repost it. But we would love to have your students come out to that to learn about financial literacy from one of the banks that is right here in our hometown, in our community. We're going to be sending you a survey link to also fill that out, just so we can hear feedback from you all. What went really great? What are some things we could have improved? I know we didn't get to all the wonderful questions, so we're going to work to try to get more of those in. And then lastly, we are doing a virtual business tour. We're doing a virtual business tour next week, March the 15th, with Sporty Dog Creations, which is a local Black-owned food business. And I put the link in the chat to that as well. Please, teachers, again, sign up your students to attend. We're going to be tasting, y'all virtually taste some food with us, but we'll be tasting some food live, along with talking about starting a business and customer service and many of the other things that go along with that. So make sure you sign up today. Again, I'm reposting all of the links in the chat, but please join us. And again, thank you so much for attending this Career Ready Friday. It's always a joy and honor to have you all with us, and enjoy the rest of your day. Happy Friday. All right, you all take care. I see all the waves. I'm waving right back at you. Thank you for joining us today.
Thank you.
Goodbye. Next career day.
Great job, team.
Thank you so much, Gerard. Appreciate you. All right, everyone take care. I'm gonna stop the recording.